In the endoscopy unit, the Stretta control module is positioned at the head of the bed and to the left to provide visualization of the screen during the procedure. A dispersive electrode is placed on the patient's back over the muscle between the shoulder blade and the vertebral column. Do not place it directly over the spine or on such areas as the hip or leg. Patients are prepared as for standard upper endoscopy with vital sign monitoring and intravenous access for sedation. The patient is positioned on their left side with pillow support to assure stability of this position throughout the procedure. The head of the bed is slightly elevated. A bite block is inserted and secured in place with an elastic neck strap. It is important to maintain a constant bite block position throughout the case, as this serves as a reference for catheter positioning. The endoscope is inserted and the squamocolumnar junction or Z-line is identified. With the stomach deflated, a careful measurement is made of the distance from the bite block to the Z-line. Upon both advancement and withdrawal of the endoscope, photo documentation is made. The measurements are recorded, assuring that the patient is in slight neck extension and that the bite block is secured. Retroflexed view of the cardia is performed with photo documentation. The guide wire is then passed through the scope and positioned in the duodenum. The endoscope is then removed, leaving the wire in place. The Stretta catheter has a flexible tip and a balloon basket combination. During introduction of the catheter, it is important to recognize the difference in stiffness of these components of the catheter. The Stretta catheter is first lubricated, then passed over the Curon guide wire. A finger is introduced in the side of the mouth and the catheter is inserted through the bite block. The catheter tip is guided past the posterior pharyngeal wall and into the esophageal inlet. The patient is asked to swallow and the catheter advanced without resistance into the esophagus. The guide wire provides guidance during the introduction and is then removed for the remainder of the case. The distance marker is set on the screen to 1 centimeter above the Z-line measurement, and the catheter is positioned at this 1 centimeter measurement at the bite block. The foot pedal is depressed a single time to begin delivery of radiofrequency energy. Depressing the foot pedal more than once will stop the delivery of radiofrequency energy. The treatment screen will be displayed with real-time temperature curves on the left of the screen. The upper curves represent the highest and lowest of the 4 tip temperatures, while the lower curves represent the highest and lowest mucosal temperatures. The tip temperatures increase with time towards the target temperature of 85 degrees Celsius, while the mucosal temperatures are maintained at a low temperature by the provision of constant irrigation to the mucosal surface. RF delivery will cease automatically when the treatment time of 60 seconds is reached, at which time the screen will dim to a gray color. A beep sounds when the treatment is completed. The goal of the Stretta procedure is to create 6 levels of lesions in the lower esophageal sphincter and gastric cardia. The first set is created 1 centimeter proximal to the Z-line. Each subsequent set is half a centimeter distal to the last. The first 4 rings are the antegrade levels. The last 2 rings are the gastric cardia levels.